Hi, this is Dr. Sonia Malik. I'm the director of Southend Fertility and IVF, located at Vasant Vihar, New Delhi. A very good evening to all of you who are viewing this live chat here with us. We seem to be in the midst of a very, very difficult period. All of us are locked down, all of us are staying at home and having a little difficult time. So it is actually the time for interaction through telemedicine, through web chats and through the Facebook. We are actually blessed to have this medium with us so that we can actually communicate with each other despite being in different places, despite not being able to meet each other, talk to each other, have those coffee sessions or those kitty parties, I would say, so that we can have some good fun. But then, well, even this, when we are at home, could be a good platform for all of us, where we can actually interact with each other, discuss things and try and help each other to understand how easy or how difficult it is to pass through these phases. But I'm sure as we advance, as we are getting more and more evidence about this disease, this condition, we are getting better and better in how we should be approaching it and how we should be able to make ourselves safe from this kind of a disease. And I would say, well, I shouldn't be calling it a disaster, although it does seem to be like a disaster now. But then man has been intelligent enough to grapple and get hold of or get some good sense of this disease and try and wade out of the deep waters and troubled waters. So although we are all sitting at home trying to figure out how we should be looking at things in this difficult time, I'm sure all of you would be having some questions, some problems which you would like to discuss with me or with any healthcare provider in order to understand how you should be conducting yourself during this period. You must be having difficult questions and easy questions which need to be addressed by somebody like me who's been dealing with disease and dealing with patients. But if you're planning to have a pregnancy or you were planning to go through an IVF cycle, that probably has been postponed now. Now, why did the doctor think of postponing your IVF cycle? Why did that happen? The reason was different. That the disease was has been spreading at a very rapid rate, and there are restrictions on movements. It's very difficult to reach your doctor, and therefore for elective procedures, for ultrasound scans, for monitorings, it becomes difficult to keep on visiting the hospital again and again and thus expose yourself to this condition unnecessarily. That is why. And then we were also not very sure 2 weeks ago or a month ago, we were not very clear on how we should be conducting these elective procedures. Therefore, it was decided by most of the infertility organizations or societies to stop the IVF cycles, not to start anything new, but finish off whatever was going on. What about embryo freezing? Why are we telling our patients to go through the IVF cycles but not transfer the embryos? Again, the embryo transfer has been deferred because again the patient has to come for certain visits to the hospital, and we are also not very sure of the outcome. Therefore, it had been decided in maybe 2 weeks ago that all embryo transfers should be deferred till this whole condition settles down and the patient can go through this safely. So therefore, collectively, it has been decided that unnecessary or non-emergency, I should not be saying unnecessary, nothing in medicine is unnecessary. I should be saying that procedures which are not absolutely urgent or are emergency should not be undertaken. Elective procedures were postponed and have been postponed, and then now these will be conducted once the lockdown is over or once the disease subsides a little. That I come back to the patient who is already pregnant or who has just had an IVF pregnancy. Now look at this patient who's just had an IVF pregnancy, and obviously she's very concerned, she's anxious what is going to happen. So of course the best thing is to restrict yourself to the house. But then we do need surveillance, we do need to check these patients, isn't it? So therefore minimal minimal exposure, minimal interaction even with your doctor is what is advised. The first visit is now actually transformed into a teleconsult. We are asking all our patients to consult on the telephone, and each consultation covers everything, what she should be eating, what she should be doing, what should she do in case she has an emergency, and when is the scan required. So a scan in the first 3 months of pregnancy have been restricted to just the very, very essential scans and nothing more than that. 3 months for my IVF. Well, this is a question that has been bothering many of us. How long should we wait before I can, do my IVF cycle now? And the reason I may not be able to tell you myself also, although we are now readying ourselves to start cycles as soon as this lockdown period is over, with of course lots of precautions, but we'll still have to wait for what the government is going to tell us. If we are allowed, or if the government tells us that the disease is now subsiding and we can start doing elective work, we will definitely, there is no restriction and there is no reason why your IVF cycle cannot be started immediately. Somebody is asking how to prepare your body for the next IVF cycle. How should they prepare their body? Well, this is a very good question and very relevant to this particular time, because we are all at home and there is nothing, we are all locked down, and basically we have all the time at hand to be able to look after ourselves. So the question is, what should I eat and what should I do in order that I remain fit? You all know, as gynecologists, we have always been advising you to eat right. So here it is, don't gain weight while you're at home, because basically if the activity or the movement is restricted, then there is a chance that you may gain weight, and which is not good to in order to have a pregnancy. You should eat the right kind of food, not too much of carbohydrate, eat a protein rich and a food which is rich in vitamins, and then the calories need to be checked a little so that you don't sort of gain weight. At the same time, exercise. You know very well that antenatal exercises, there are so many apps that are available, plus there are so many people now who are actually making you practice antenatal exercises with them over the net. You can join any one of those classes and start doing those antenatal classes if you are pregnant. If you are not, and if you are waiting for an IVF, or you are wanting to prepare your body for an IVF, again, I would suggest that you start a yoga class or you start an exercise class, because this time where there is such little activity and you are working from home, 90% of you are also working from home. It's not as if you're not working, but you're working from home, hence the activity is very restricted. Therefore, eat right and exercise right. You must do it, otherwise it's going to bother us with the pregnancy outcome. IVF. Are the embryos harmed if they are frozen for long? Is a question from an anonymous person, somebody who does want to share her name with us, but she says that if, as is advised, to keep the embryos frozen, is it going to cause a problem with the quality of the embryos? No, never, that's not the question. Frozen embryos are very, very good, and in fact frozen embryos may actually give better pregnancy rate than the fresh embryo transfer for various reasons. And if you have been asked to freeze your embryos, don't get alarmed and don't get upset. As soon as the lockout, as soon as this viral condition is going to decrease, the embryos will be transferred back to you, and I'm sure it is going to give rise to a pregnancy. Somebody is 41 years in August, and she has a 6-year-old son, and she is trying for another child through an IVF at this age with her own eggs. A difficult proposition at 41 years with her own eggs. She has a 6-year-old child. Well, I cannot swear that she cannot have her own eggs. She cannot have a pregnancy with her own eggs, but her chances of conception are very low with her own eggs. It is to the tune of 2 to 4% at 41 years, especially in an Indian woman. If it was a Caucasian woman, the chances would have been slightly better, but the quality of eggs goes down, the number of eggs goes down as soon as the patient crosses age 35 in our country. Somebody saying that they were to go through an IVF at this time, but due to the virus it has been postponed for say 3 months now by their doctor. So she's a little upset about it, obviously, because it has been postponed. So I would suggest, and I would tell her once again, that there's no need to get upset about it. I know it's a little discouraging because your plans are upset. And also, having said, there's another angle to it. You know, most of you, about 90% of you are sitting at home, and you are working from home. There's so much of time at hand, and also you don't have to take chutti now from work to go and attend a clinic to get your scans done, to get monitoring. So you're so free, and you feel that this is the right time that you could go in for an IVF or a procedure like that, wherein it is not going to disturb your work schedule and you can also have rest. But the time is not right, because you are exposing yourself to a lot of infection and a lot of problems once you step out of the house, number one. And the other thing is, repeated contacts with unknown people is again problematic for you. That is the reason why all these precautions have been taken, and you have been advised not to step out and not to go in for elective procedures, because it can lead to problems for you more than anything else. The center that you visit should be very safe. Even when the lockdown is over, the center should be such that it takes precautions that you don't get harmed, because this disease or this condition is not going to go away in 1 month. It may stretch for a couple of months, and all along we will have to now understand and change our method, our day-to-day life, so that we can know that we are safe and we don't have any kind of problem. So all the hospitals, and especially, like, I can only talk about my own center, we are taking precautions and we are developing protocols so that we can assure the safety of all our patients when they start coming to us. And it is definitely going to be a COVID safe kind of a center, where we will take we will go a mile ahead and take that extra precaution to see that not only you, but our healthcare professionals are also workers, professionals, everybody is safe and doesn't get exposed to such a thing.